Good afternoon. My name is David Young. I'm the Adult Center pharmacist at the University of Utah, and I want to welcome you to Symposium 19 at this historic event for us in pharmacy, because this is the first time ever that pharmacy has been given its own symposium. And it's a tremendous honor to have this responsibility. And one of the things we'd really like to highlight for you, our multidisciplinary colleagues, is how to partner with your pharmacy team, what we entitle Prescription for Success. Myself and then my co-chair, Emily Dufek, is a pharmacy technician at the University of Minnesota. Some of my presenters today, or at least my co-presenter today, Dr. Jeffrey Zobel, and I do not have anything to disclose related to this presentation. We'd like to describe the roles, and when we talk about pharmacists, we're talking about pharmacists and pharmacy technicians embedded within this symposium as a united team. And having that pharmacist and pharmacy technician team is critical to the success of providing optimal pharmacy care for our patients. So we'd like to describe the roles of what that looks like, both for pharmacists and pharmacy technicians, and then more importantly, describe the impact and opportunities that you can do, or opportunities that are available to help partner with both patients, families, and care providers in optimizing patients' CF care. Some of the symposium speakers are some of my colleagues here. Dr. Jeffrey Zobel will talk about pharmacists and their role on the impact of the team. And then we have our other colleagues from Kelsey O'Keefe is a pharmacy technician, and she's going to talk about the roles of pharmacy technicians. And then lastly, and actually probably more importantly, or most importantly, the most impactful piece to this presentation is we've invited a couple of individuals that have CF or have children with CF, and they're going to discuss the impact that team pharmacy has had upon their lives. And that's really a unique thing to do, to have a patient come explain in their own words what it means to them and their care. As all of you know, pharmacy or CF is very complex. It's a multi-organ disease. And because of that, there's multiple organs are affected by this and often require medication therapy. What I wanted to highlight here is that a CF patient on average has 10 medications that they take on a daily basis to help control or at least minimize the impact of CF on their lives. That's a lot of medicines. Because of that, there's multiple challenges that we face with CF, things such as adverse effects. We've seen the modulators get approved, and the most recent, the triple combination modulator, was approved last fall, and the adverse effects that are listed in the package insert are definitely not the adverse effects that we're seeing now that we have widespread use. So it's something that we pay attention to, and we're getting more and more adverse effects that are popping up. Also embedded within that, team pharmacy, we have expertise in drug-drug interactions. And as you can see, when patients are on 10 or more medicines, the likelihood of them being on a medicine that may interact with the medicine that they're already on is very high. And utilizing team pharmacy for their specialized knowledge and skills in this area can be very helpful. What I didn't put on the slide is drug-disease interactions. So this is where, you may have like liver issues or kidney issues in addition to CF, and that may require adjustments in the medication therapy. We can have entire talks, which actually we do have talks on this in utilization and care symposiums and workshops on factors that influence people's ability to afford their care, afford their medicines. Within the realm of team pharmacy, it's things like prior authorizations, insurances, and navigating the muddy waters of insurances, and also navigating having to go to multiple pharmacies and not just a singular pharmacy can be very challenging for not only us, and we know we speak the language of pharmacy, but think about families and patients who may not understand the nuances of one pharmacy versus another. And then cost of care between outpatient and inpatient care. And what really impacts people is how much they pay for their medicines. And at different points, patients may have to decide whether they're going to pay for their medicine or pay for rent and or food. And one of the things team pharmacy can help you with is overcoming some of those challenges. We can't overcome all of them, but we can try. Now, the CF Care Guidelines that were published back in 2004, 2009 emphasize optimal care and facilitating access to pertinent medical resources, I think some of which would include medications. They recommended a comprehensive evaluation by every team member, and who they listed specifically were nurses, respiratory therapists, dietitians, and social workers. The evaluations, they said, should encompass adherence. And because of the complexity, as we discussed earlier, of a multi-medication disease, assessment of adherence and potential adverse effects with that adherence should be reviewed on a regular basis. What was of note in those documents is the pharmacist and the role of team pharmacy was not addressed. And that's what our symposium today here is going to try to address for you and highlight for you. In 2005, internationally, pharmacists and team pharmacy has been recognized by the European Society of CF, the CF Australia, and the UK CF Trust. They've defined roles and responsibilities of what team pharmacy could do for the multidisciplinary care teams. And they've even actually listed out how many pharmacists or team pharmacy members would be recommended with respect to the size of your center. In 2013, a survey by colleagues, Baca and colleagues, surveyed the centers, the CFF accredited centers in the United States, and found out that only 58% of centers had a dedicated pharmacist, which means that 42% of centers did not have a dedicated pharmacist. 100% of the centers that didn't have a pharmacist felt that having a pharmacist and or pharmacy technician, team pharmacy, would be beneficial. And 14 centers had no pharmacy involvement at all. In 2015, a large step forward for our team pharmacy profession was the executive committee at the CF Foundation and the center director committee voted to amend the document to add pharmacists and pharmacy technicians as recommended team members to multidisciplinary care teams. That was a historic day for us in 2015. Let me give you just a brief timeline of what's happened in the last 5 years with respect to team pharmacy. I just spoke that we got added as recommended team members, which was massive. In 2016, another large step where the CFF patient registry questionnaire added a question regarding if your patient had seen a pharmacist. And they also had, centers now have to report the percentage of patients that have seen a pharmacist within and or team pharmacy, I would call this, within the past year. In 2016, the CFF provided grant funding to help implement and develop pharmacy care services across care centers throughout the United States. And in that first round, about 50 centers were funded to help implement those services. In 2017, 5 pharmacy-related questions were added to the CFF Patient and Family Experience Care Survey, trying to find out what does team pharmacy mean into the care of the patient and families and their lives. A second round of funding by the CFF was provided in 2019, which funded 54 centers to add pharmacists and or pharmacy technicians to their care teams. And then another historic moment happened last year when team pharmacy got their own abstract category at NACFC. And if that was not sweet enough, the deal got sweeter in that we got added to have a symposium, which you're part of the symposium with us today. And it's unfortunate that we have to do this virtual, but nonetheless, we're very appreciative of being able to be given this platform. What's the future? That's still yet undetermined, and we're still trying to define our path and our role on care teams and improving the lives care for our patients that we see. If you look at time and across time and the percentages of patients seen by a pharmacist, you can see that we've been on a linear growth from 2017, 18, and 19. And in 2019, nearly 48% of patients were seen by a pharmacist, which was a large step forward for team pharmacy and the care that can be provided for our patients. And with that, I'll turn the time over to my colleague, Dr. Jeffrey Zobel.
Thank you, Dr. Young. It's my opportunity and pleasure to talk to you about the role of a pharmacist as part of the care team, that we're not just the medication experts. We can actually do a lot more to the care of our patients. And so there are 3 different types of pharmacist involvement in CF care that have been identified in the literature. And I have in an article by Dr. Young and colleagues that was published in 2019, these were identified as a limited access pharmacist, a full access pharmacist, and an integrative pharmacy team. So when we talk about what a limited access pharmacist is, don't be fooled by the word limited. This does not mean that this person does not do as much. This, in terms of access to the patients, is limited because this pharmacist is not actually physically located in the outpatient CF clinic. They're usually inpatient pharmacists who are consulted by the CF clinicians to do various tasks, such as answering clinically based questions, assisting in evaluating serum drug concentrations, such as tobramycin monitoring, providing medication education to patients who are admitted either for newly diagnosed or for other patients who are diagnosed, and then monitoring for drug-drug interactions. For 10 years prior to me starting in 2016 in the primary children's CF clinic, I was considered a limited access pharmacist. However, I was a member of the care team. I went to NACFC for multiple years. I was consulted to come to clinic, and then I attended inpatient rounds and rounded on the patients on a daily basis. So a limited access does not mean that they are not just doing things, but there's a large scale, but these are just some of the things that have been identified by the literature in several studies. One area of benefit from the limited access pharmacist that has been published by Jeff Chess and colleagues at St. Christopher's in Philadelphia. They did show that the benefit of a limited access pharmacist on patient care was able to decrease the hospital length of stay by having this type of interaction and doing serum drug monitoring appropriately. And so you can see that limited access pharmacists can have impact on the care of our patients. A full access pharmacist is a pharmacist who is physically located in the outpatient CF clinic, and they are considered a member of the multidisciplinary CF care team. And so since January 2016, this is what I've transitioned to, from a limited access pharmacist to a full access pharmacist. And this type of pharmacist engages with members of multidisciplinary care team, as well as patients and caregivers in a comprehensive fashion, following them every clinic, both also inpatient and outpatient. And so that is some of the roles that this patient access does. It kind of adds on to what a limited access pharmacist does. From the article by Young and colleagues in 2019, some of the roles and responsibilities of a full access pharmacist were delineated. You can see some of the things are very similar to what a limited access pharmacist would do, such as assessing drug dosing, drug interactions, adverse drug reactions, interpreting pharmacokinetic monitoring, and also providing drug information and counseling to patients and caregivers. But some of the other things that are added on to what a limited access pharmacist would do be also to ensure safe and appropriate cost-effective therapy by helping patients with access to medications, helping with sustainability of medication regimens, and developing strategies with the patients and families to improve medication management. But one of the biggest things, we serve as a liaison between the CF clinic, the hospital and inpatient care teams, community practitioners, payers, and outpatient pharmacies. This is something that a full access pharmacist does in that comprehensive fashion, understanding exactly the whole picture of the patient and family. Some of the benefits that have been published, and this was an article by Redfern and colleagues in 2004, showed that a full access pharmacist can improve medication access, sustainability of treatments, improve provider communication, decreasing medication errors, and decreasing the cost of medications for patients. In the study by Young and colleagues, actually looked at the benefits between a full access and limited access pharmacist from the patient perspective. It showed that there was a statistically significant improvement in medication refill authorizations when patients were followed by a full access pharmacist, an increase in discussion of medications with CF team members, as well as a reduction in the number of pharmacies utilized by patients to fill CF medications, as was highlighted by Dr. David Young earlier in the presentation. An integrated pharmacy team, this is where you have a full access pharmacist working together with other members of team pharmacy, which would be our pharmacy technicians. As those technicians are also considered members of the multidisciplinary CF care team. This type of interaction, they do everything they're listed that the full access pharmacist does, but in an integrated fashion, not just opposed to one individual. Some of the benefits from the literature that have been highlighted, there's multiple studies that have been done. Groups out of University of Kentucky, University of Utah have shown by having integrated pharmacy team able to improve medication access, improvement in body weight and body mass index, which showed improvement in medication access, and those are the results of that. Improvement in prompt medication refill authorizations, an increase in discussion of medications with CF care members. And a study by Wright and colleagues at the University of Iowa showed by having an integrated pharmacy team was able to decrease prior authorization submission times. And then in a recently published study at the Primary Children's CF Center, having that integrated pharmacy team involvement showed a decrease in medication delivery times as well as the decrease in the number of pharmacists utilized by our CF patients. So in a study at the Primary Children's CF Center, this is something we did back in 2017, 2018. We did a pre-post analysis prior to having a pharmacist and integrated pharmacy team involvement in looking at adherence of our patients. And we showed that having that integrated pharmacy team, as well as a full access pharmacist, are able to statistically improve adherence in patients before and after by having that involvement. And so by having a dedicated full access pharmacist, patients were able to improve their adherence than compared to before having that pharmacist involvement, as well as the integrated pharmacy team. And both of those odds ratios were statistically significant, as well as in decreasing hospitalization rates. And so the risk of being hospitalized by having patients who are followed by the integrated pharmacy team versus not it led to a 33% reduction in hospitalizations, as well as having patients with adherence, just adherence alone. So getting the medications to the patients had a 58% reduction in hospitalizations in patients versus who are not adherent to their therapy. And there was also a correlation analysis that was done with this, showing a negative correlation between adherence and hospitalization rate. So the more the patients filled their medications, the less likely they were be hospitalized with patients who are not taking the medication. So the conclusions of both Dr. Young and myself's presentation, that medication regimens for CF patients are very complex. As you can see, it's a multifactorial and multi-organ, and they're fraught with multiple challenges that patients face. The International CF Care Guidelines since 2005 have included pharmacists as members of the multidisciplinary CF care team. In the United States, we know that pharmacists now are recommended members of the care team, and we have multiple different types of pharmacy involvement. There's lots of roles that we can play, and the benefits have been identified in the literature that we can provide for care teams, patients, and caregivers are being realized and only continue to increase as more pharmacists are added to care teams. Thank you.
Hello, my name is Kelsey O'Keefe, and I am a CF pharmacy technician at SSM Health Cardinal Glennon Children's Hospital, and will be discussing how the role of clinical CF pharmacy technicians is beginning to expand to cover more areas than just the conventional role of assisting pharmacists in the act of dispensing medication. There are no relationships to disclose related to this presentation. I got this inspirational quote from the movie 5 Feet Apart that came out in 2019. As you may already know, it's a movie about two teens with CF and their journey of falling in love while having to stay 5 feet apart. This quote really resonated with how my CF patients and families felt about their treatments and everything that came along with caring for a loved one with CF. This whole time, I've been living for my treatments instead of doing my treatments so I can live. Many of you have had patients who living for treatments is all too real for. What if there was a way to flip the mindset so that our patients can come to treatment to live their lives to the fullest instead of living for the treatments? Well, spoiler alert, there is, and we can help. This is the reason I'm here today, why my role at Cardinal Glennon was created, why I'm speaking with you today, to help our patients live their life to the fullest. In collaboration with my CF team, I educate patients and about their treatment path and create ways to ease the cost burden of medication. The treatment's the crux of our responsibility to our patients. However, with the addition of this role, we have been able to expand our positive impact on our patients' lives to help coach, encourage, assist, as well as treat. One of the main objectives I will focus on today is defining the role of a dedicated CF pharmacy technician in a cystic fibrosis ambulatory care clinic. Currently, there are 59 pharmacy technicians that have been grant funded by the Cystic Fibrosis Foundation nationwide. So I will focus on what exactly our day-to-day tasks involved. Secondly, I will share some studies that have demonstrated positive impact on pharmacy involvement in CF care. Another main focus I will be addressing is how a pharmacy technician can help support CF clinic by overcoming barriers and challenges associated with medication access. Lastly, I'll share some patient testimonials in response to our exceptional patient care provided by pharmacy services. The traditional role of pharmacy technician has expanded beyond medication dispensing and processing prescriptions to direct patient care services. This expanding role will serve to increase the amount of time pharmacists and other CF team members can devote to patient care services. Currently, only about 21% of a pharmacist's time is dedicated to services not associated with medication dispensing. Examples of the possible day-to-day responsibilities of a dedicated CF pharmacy technician may include interviewing families and updating medication lists, obtaining refill histories from pharmacies or patient assistance programs, conducting monthly follow-up phone calls to encourage adherence to therapy by consulting with the patient or family to assess barriers to adherence and to attempt to motivate for improved medication use. Technicians may also be responsible for assisting with enrollment in patient assistance programs, as well as completing prioritizations and appeals. Also, improving patients' experience by troubleshooting acquisition issues to prevent delay in therapy, as resolving improper claims on prescriptions, such as noticing the pharmacy not billing a copay card properly. Responsibilities also may include streamlining processes by consolidating the number of pharmacies used and serving as a direct advocate for medications filled through in-house pharmacy. Additional responsibilities may include meeting with patient in clinic and attending weekly team meetings, verifying insurance benefits by processing test claims, or conducting benefits investigation to ensure prescriptions are routed to the appropriate pharmacies. Lastly, contact patient or caregivers monthly to coordinate medication refills. At Cardinal Glennon, we had a newly diagnosed patient with CF who was only 5 weeks old and in need of starting enzymes right away. His insurance was not yet active through the state of Missouri, so I immediately took action by obtaining a free trial for pancreolipase and collaborated with the inpatient and outpatient pharmacies to ensure we had enough supply to get him started. He was able to leave with 200 capsules of pancreolipase in hand at no charge. Had he gone to his local pharmacy where there wasn't a dedicated clinical CF pharmacy technician, his treatment more than likely would have been delayed. In another example of a patient case, we had an 18-year-old male who has 3 different insurances, which can be challenging to navigate. His primary insurance mandated a 90-day supply be filled on pancreolipase, whereas his secondary and tertiary coverage would only allow 30 days. And I called his insurance companies and there was really no way around it, so he was left with an $80 copay. Being trained in what other programs are available, I immediately took action to enroll our patient in HealthWell and was able to obtain the medication for the patient at no charge. Oftentimes, if we allow ourselves time to think outside the box and fully utilize our resources, we can overcome challenges on behalf of our patients, thus improving patient experience and satisfaction. A third example is when one of our patients was recently prescribed Estrianam and was needing 2 Pari Altera nebulizer devices due to split household. The family planned on using money raised from a fundraiser to help cover the cost of second device. However, I intervened by enrolling the patient in the HealthWell CF treatment fund, so I was able to obtain a second device at no charge, which in return saved the family over $1,000. Multiple studies have demonstrated the positive impact of pharmacy involvement in CF care. For instance, a study conducted by Intermountain CF Pediatric Center in Salt Lake City, Utah, evaluated the impact of adding an advanced practice pharmacy technician to a CF team and found that patients with CF had an average of 10 prescriptions with only about 48% adherence rate. Nearly 40% of the patients with CF reported utilizing 3 or more pharmacies, and the addition of an advanced practice pharmacy technician led to a decrease in the number of pharmacies utilized by a 38% reduction, as well as an increase in the total prescriptions filled by the outpatient pharmacy. Additionally, a retrospective review led by University of Minnesota CF Center evaluated the impact of an advanced practice pharmacy technician had on prior authorization management for children and adults at a CF center. 439 test claims resulted in 415 of those required prior authorization in a 1-year time frame. Of the 415 prior submitted, 353 were initially approved. There were 62 PA denials. 38 of the 62 denials resulted in an alternative medication being prescribed. The remaining 24 denials were appealed, and 14 of those appeals were approved. The advanced practice pharmacy technician has a high rate of successful PA and appeal completions, thus mitigating the burden of process from nurse coordinators. This has allowed for nurse coordinators to increase time spent in direct patient care. There was a recent study published by colleagues in Salt Lake City, Utah. The purpose of their study was to characterize the impact of pharmacy technician on medication access in the care of CF patients. A retrospective review and analysis of patient medication profiles for patients followed by the integrated pharmacy care process model was performed. 2 electronic prescription pathways with pharmacy technician involvement were analyzed. One pathway using a specialty pharmacy CF pharmacy technician examined CF specialty medication delivery times. The other pathway examined the impact of the clinic-based CF pharmacy technician on the number of filling pharmacies for patients. 153 patients met inclusion criteria in the CF specialty medication delivery analysis, and 56 patients met inclusion criteria filling pharmacy analysis. The median delivery time for Dornase alpha decreased from 8 days to 3 days. The number of patients utilizing 1 filling pharmacy increased from 8 to 21, and utilizing 3 pharmacies decreased from 14 to 1. In conclusion, the study demonstrated that pharmacy technicians, as a part of an integrated health system pharmacy care process model, improve access in the care of CF patients. In August of 2018, SSM Health Cardinal Glennon Children's Hospital implemented an advanced practice pharmacy technician as a member of the CF care team. The purpose of our study was to evaluate process and financial outcomes after the addition of the pharmacy technician to the team. This study's findings covered my first year with the team, which was from August 2018 to August 2019. During that time, I attended weekly CF clinic, which consisted of 44 clinic days. During our clinic on Mondays, I met with patients and their families to discuss any medication acquisition issues they were experiencing and find ways to resolve those issues in a timely manner. This analysis consisted of 105 pediatric patients with CF. The patient's mean age was approximately 11 years old. Roughly half of those were female, and just over half were homozygous Delta F508. Adherence to Dornase alpha was measured by the medication possession ratio quarterly by verifying the last 6 months of refill history with the patient's pharmacies. Data was configured by taking the sum of the day supplies for all fills within a 6-month period divided by 180 days. The goal was to be above 80%. As you can see, the average quarterly MPR for Dornase alpha improved from 66% in visit 1 to 85% by visit 4, roughly increased by 19% over 1 year. As a result, to help increase enrollment and adherence to prescriptions, I completed a total of 145 enrollments, averaging 1 to 2 enrollments per patient. The various copay assistance programs were included, but not limited to HealthWell, the Assistance Fund, and other manufacturer copay savings programs. This graph indicates the projected annual savings during this study exceeds $1.5 million. This amount was configured by taking the maximum amount the copay card or grant would allow multiplied by 12. That means the average number of savings per patient within this demographic is roughly $15,000. I consolidated pharmacies for over a third of our patients and transferred about a third of our patients to Cardinal Glennon outpatient pharmacy, which averages 10 to 11 scripts per patient. Most of our patients' meds filled at Cardinal Glennon are consolidated to one shipment that arrives directly to their doorstep in colorful boxes, eliminating the hassle of them making multiple trips to the pharmacy. Since there's an average of approximately 10 to 11 scripts per patient, transferring prescriptions in-house significantly improved profits. The projected annual profit to Cardinal Glennon Children's Hospital exceeds $270,000, which averages about $9,500 per patient. More specifically, commercially insured patients whose treatment required high-cost drugs such as Dornase alpha, inhaled tobramycin, and pancreatic enzymes triggered this number to rise. In the one-year time frame, a total of 229 prior authorizations were completed. Of those 229 prior auths, 215 were initially approved, 7 out of the 229 were appealed, then approved, resulting in approximately 97% overall approval rate. The remaining 7 PAs were denied by insurance and proper action was taken. Before I joined the team, one of the challenges the CF team faced was how to make patient visits more efficient. With so many stops required during each visit, whether it's seeing the dietitian, social worker, respiratory therapist, research coordinator, psychologist, or pharmacy, visits were simply too time-consuming and a lot to keep track of. The way our clinic visits flowed was that we circled each department that needed to see that patient that day on a physical checklist. This checklist was used to track that the patient saw all departments they needed to see that visit. Once all teams were checked off, the nurse could have confidently check out the patient. If somehow a stop was missed or unavailable, I'm able to follow up with patient via phone afterwards as needed. I was able to make visits more efficient by doing quicker door visits or entering the room during the pharmacist portion. This helped cut down on the appointment time as well. Another challenge is who should fund the pharmacy technician position? Should it be the specialty pharmacy, outpatient pharmacy, pulmonology department, hospital, or funding from the Cystic Fibrosis Foundation grant? For our facility, the position was first funded by the CFF grant. Funding has since shifted to being from the hospital generated through prescription revenue. There are also challenges faced in regards to access to medications. For instance, when a new drug is released or a new age limit is approved by the FDA and the insurance company lags behind. A perfect example of this is when Trikafta was approved by the FDA back in October of 2019 for ages 12 and older. I don't know about other pharmacy technicians, but I constantly had to nag these insurance companies and resubmit the info, anxiously awaiting for them to get on board. Another challenge is when a patient has no coverage versus too much coverage. An example was provided earlier when the patient had 3 different insurances. How can we overcome that barrier so we can get this medication for as cheap as possible? Or if the patient doesn't have any insurance or if there's a lapse in coverage, what can we do to help? Are they eligible for patient assistance through the manufacturer? Or is there a free trial voucher available to get them by until their insurance becomes active? Also, a patient might exhaust the maximum benefit allowed on a copay card. So we have to problem solve. What do we do from here? Are they eligible for patient assistance once this happens? Will the assistance program allow it? Or will HealthWell be able to pick up their copay if processed as secondary or tertiary? As illustrated on this slide, pharmacy technicians can earn some pretty flattering compliments. Our role of problem solvers is viewed as being rock stars, fairy godmothers, or godsends by grateful patients and their families. The impact we have on these families is incredible and so rewarding. This is why we are here, to take stress off those we are caring for and to make these expensive, life-saving medications attainable. This is why not only what we do matters, but how we do it matters. It matters that we make our patients' lives just a little bit easier and put a smile on their face during this challenging time in their lives. We work together as a team to improve their lives and are willing to do just about anything to lift that burden. It is a privilege to be a part of their lives and make an impact. Unfortunately, COVID-19 has put a dampener in my works of art most of this year due to working from home. As a matter of fact, I had one of our parents whose child is a Cubs fan call saying, "Oh, I figured you weren't there on campus this month because my son's box of medication wasn't decorated." And if you know anything about St. Louis, we are not Cubs fans. So since I did not own or plan on owning any Cubs memorabilia or stickers, I obtained images online and taped them to his medication box along with fun facts about the Cubs. He absolutely loved it and it made it laugh. My point here is a small act of kindness can go a long way, and to put a smile on these children's faces is why I do it. In conclusion, the advanced practice pharmacy technician role is a vital component of the multidisciplinary team, with proven benefits to both the CF care team as well as people with CF and their families. By extending the role of the integrated advanced practice pharmacy technician to include a multiple clinical task, pharmacists and other CF team members can focus their time on more complex patient care services. The advanced practice pharmacy technician can conduct various clinical tasks as well as advocating to make expensive, life-changing medications attainable for the people with CF. The advanced practice pharmacy technician role has proven to enhance patients' experience and adherence by providing accelerated access to treatments. This decreases the time and energy busy patients with CF need to spend on this vital part of treatment. The impact of this role hits home when grateful parents have this to say about their experience. It was like I was living 5 separate lives and you just took one of them over for me. Our CF centers make an even greater impact serving our patients and their families with this enhanced clinical pharmacy technician role. Thank you for your time. Please submit your questions in the Q&A box to be considered for the live panel discussion on Friday, October 23rd from 11:30 a.m. to 12:30 p.m. Eastern Time. I will address any questions you may have during our live panel discussion. Thank you.
Hi, my name is Jennifer Hepworth, and I am so excited to be here with you today and to be able to talk about pharmacy. Today I'm talking about the impact of your pharmacy team on patients and families' lives as a CF parent. As I said, my name is Jennifer Hepworth, and I live in Salt Lake City, Utah, and my daughter attends the clinic at Primary Children's Hospital. I have no relationships to disclose, and this is my cute family. My husband John and I have been married for almost 9 years. We have 4 awesome, cute little kiddos. Ethan is our oldest. He's 15. We have, and his carrier status is unknown. We have Aaron, who is 12, and his carrier status is also unknown. We have Penny, who is 7, and she is our daughter with cystic fibrosis. And then we have our cute little caboose is Sadie, and she is 4, and she is not a carrier of a CF mutation. Introduce you to the star of our CF show. This is Penny, and Penny is just the cutest, most delightful, silly, funny, engaging, sassy, smart little girl you could ever hope to meet. She is a big fan of gymnastics. She really loves working on her somersaults and her cartwheels. She loves doing flips on the monkey bars. She loves riding her bike. She is just a supremely active kiddo, and she loves to bake. She loves to help teach her little sister's preschool that we're doing in our home because of COVID, and she's just the world's best TA. She, of course, also has cystic fibrosis and goes through a lot, but that doesn't stop her from wanting to serve others. Her current goal is to be a scientist when she grows up, with the focus unknown, but she's super into lab coats, so she's all about the science. Previous desires for employment have been a firefighter or a police officer or a surgeon. So everything she does, she's always wanted to serve. She has had, of course, CF-related issues in her life. This past summer, she had her first sinus surgery as her right frontal sinus was completely opacified. And we didn't know that there was a problem until it was so bad that it was pressing onto her eye and she started complaining of eye pain because she is a tough kiddo. She experiences a lot of stomach pain. She almost always has a stomach ache, and we are working on figuring things out. Things are getting better. She has really been healthy in a pulmonology aspect. She has 122% FEV1, and she's just rocking and rolling, just the cutest kid in the world. She loves helping her fellow CF friends with filming videos of maybe a new procedure or new medication or something new that they just got introduced to. So she is in our friend group. She is the sinus rinse queen, and she will film a video for how to do a sinus rinse all day long. She is such a pro. And if a kid is scared of doing an antibiotic, or they're worried because it's yucky, she'll FaceTime with them and encourage and just really talk them through. Like, she is just such a great kiddo. And every star needs co-stars, and these are hers. So Ethan is awesome for her. He is the oldest. He is so encouraging for her. He is always cheering her on, helping her when she's down, just cheering her up any way that he can, and always ready to help her. Aaron is always willing to sit with her during her treatment time, which I'm sure you know can get very loud when they are watching a show and trying to have the volume loud enough to hear it over their treatment. So it gets crazy, but he's right here with her every time. And then our final co-star is Sadie, and she is definitely the CF sibling pro. She is at every appointment. She is at every lab draw. She is with Penny, trying to cheer her up no matter what's going on. There was one time we were in an ER in San Antonio when we were on vacation, and Sadie decided that putting Play-Doh eyebrows on was going to make her sister laugh and help her feel better, and it sure did. She also loves to start shakies and get nebs for Penny, and she's just a really good helper. We have Penny's diagnosis story. She was diagnosed when she was 3 weeks old. When she was born, she was 7 pounds, 15 ounces. And the next day when we left the hospital, she was down to 7 pounds. And the first 3 weeks before her diagnosis, I was that annoying first-time mom to every pediatrician. My boys are technically my stepsons, so I didn't have the brand new infant years with them. So I had my first-time mom with my pediatrician, just making him crazy, because she was doing lots of snorting, and she was just breathing weird, where she'd like try and catch her breath, and she was just like gasping. And we had every excuse under the sun. We were told that she was just, oh, she's just clearing amniotic fluid still, or she just has really small nasal passages. And that was not cutting it for me, because I knew my baby should be able to breathe. And at the third time I had taken her in, at that 3 weeks, we were told that she had been flagged on the newborn screening for cystic fibrosis. And of course, you never want to hear a diagnosis about your child. And the only thing that I had known about CF was that my husband had had a cousin who had passed away from it when she was 14. And so I am holding my brand new baby thinking that she's just been given a death sentence, and it was very traumatic. And I don't remember driving home, but we made it there. The next day, we were down at Primary Children's Hospital to do my daughter's sweat chloride test. We also saw a genetic counselor, and later that evening, the genetic counselor called and said, yes, absolutely, she has CF. Her sweat chloride was 106 and 109, so a very firm diagnosis. And the day after that, we were in CF clinic for the first time. As I'm sure you know, that it's a big blur getting a diagnosis like that, and going into clinic for the first time can be overwhelming. And we don't remember too much from that first visit, except that they told us that it was going to be a very expensive disease and we better have good insurance. When we were there later at her 6-week appointment, we were told what her mutations were, and she has Delta F508 and G551D. We were told if she had to have CF, that these were the mutations to have. Which brings us to ivacaftor. So the biggest blessing in the whole world was Penny being able to start ivacaftor when she was 2 years old. And she was able to start it when she was 2 years, 1 week old, and that was because of our amazing pharmacist at our clinic. When it was approved 1 month before her 2nd birthday, we got a call from our pharmacist saying, these are the things that we need you to do to get lab work, get your eye exam, get all of these things taken care of because she's getting ivacaftor. And it was a huge, exciting day when it got there, but it had taken a lot of calls and prior authorizations and insurance calls that our pharmacist had done, because he had taken that off of my plate to make sure that Penny could get that as soon as possible. And because of this drug, she has since become pancreatic sufficient and no longer has to take enzymes, which is a huge deal for her, as no child wants to swallow 30 pills a day. So pharmacy at clinic. I'm not sure how it is run at every clinic, but pharmacy is one of the first providers that we see when we go in. She gets her vitals done with the MA, and we get paperwork stuff figured out, and then our pharmacist is in the room. And our pharmacist is incredible. He has really helped Penny learn how to advocate for herself and how to be her own best advocate. He reinforces her knowledge of her medications that we teach her at home. She has known all of her medications since she was 3 years old. She could tell you what everything was, and she could tell you why she took them. And our pharmacist really helped to reinforce them, because mom can tell you so much, but it's another grown-up that is going to really keep that information there. When clinic is when we see Jeff at clinic, Jeff is our pharmacist, it's really great for Penny, because he can really talk with her and see what's going on in her life, see how she's feeling, because she has some anxiety and she gets really nervous when she's going into clinic, even though she's known everybody her entire life. But she knows that Jeff is not going to be doing a throat culture or a lab draw. He's not going to be doing anything to her. And so it's much more comfortable for her to be able to actually verbalize how she's feeling and what she's dealing with and how she feels about different medications. And he really empowers her to do that by talking with her and explaining to her everything that's going on, instead of just, okay, mom, is she getting this med, this med, this med? It's to Penny, how are you doing with this? What is this doing for you? And that has really made a big difference in her confidence at clinic and being able to speak for herself. Another key aspect of the CF pharmacy team is, of course, the farm tech. And we have amazing ones associated with our clinic. We are so lucky. The farm tech at the Intermountain Specialty Pharmacy, unfortunately, my insurance does not allow us to use it. However, I know so many parents that have the best experience with it, and I wanted to share a brief story that another CF mom at our clinic has shared. The CF tech that we work with, her name is Stephanie, and this mom says, having Stephanie to work with at Intermountain has made medication fill so much easier than any other place we have used. And trust me, with specialty meds and filling home health orders, we have used plenty of others. One of the ways she makes things easier is she calls me. She will run through the list of medications available for refill, and if there are any that she knows we will need that we don't have refills left on, because our kids have CF and she knows we don't just stop certain medications randomly, she will have already submitted a refill request to the clinic before she calls me. Another is she knows exactly how the copay assistance programs and CF grants for medications and supplements work. She knows exactly who and what to bill in the correct order, so everything goes through seamlessly. Our calls last less than 10 minutes, and there are never any hiccups with getting my kids' meds on time or billed correctly. When we use other pharmacies for various reasons, usually insurance change or insurance specifies we have to use a certain pharmacy, it takes multiple attempts and or 30 minutes to an hour on the phone of me explaining how and in what order to bill everything to make it work, and then something still goes wrong. Stephanie just makes it easier for me to focus on my kids, their treatments, and giving them their medications rather than spending hours on the phone I'll never get back. And so Farm Tech, an absolute integral part of the pharmacy experience at clinic. Medications. I'll just describe these pictures really quickly. So the first one was when Penny was about 1 year old, what she was taking with breakfast. The second one, when she was about 2, was her week's worth of medications. The third was right before she stopped taking enzymes last summer. So she was 5, when she was 5. And this last one is what she has to take now, minus her evening dose of Kalydeco. Our pharmacist is so incredible. He's always ensuring that the medications being prescribed to us are covered by insurance. And if not, he figures out a substitution for that drug. And if there is none, he submits a prior authorization before we even leave clinic. So I know that I am not going to have to go and fight to fill a drug because he has already taken care of that for me. Our pharmacist and our farm tech deal with all of our copay assistance and health well issues. They remind us about re-enrollment. They help us through re-enrollment or take care of it themselves when they are able to. They ensure the billing is done correctly. Dealing with insurance and pharmacies, as I'm sure you're aware, can be exhausting. I am a part of a really big online CF mom community, and I asked them how long they spent on average every month with either insurance to get coverage or with the pharmacy itself. And what I was told is at the beginning of the year, most people are spending 3 or more hours per week working out health well and copay assistance issues, just getting them billed correctly, getting them set up, and about half of them said their monthly time spent on calls averaged between 1 and 4 hours every single month, and the rest averaged on about 20 minutes. I am so grateful and so lucky to be in that 20-minute portion of the group, because we are able to get our medications with no issues because our pharmacist and our farm tech have already taken care of all of those issues for us. We don't have to deal with getting things set up because it's already been done, and that is a huge time saver for us, and it really does improve so much of our care that is not a stress that we have to take on. Another thing that our pharmacists have done for us is advocacy. They were able to help get, so everybody in Utah, the insurances now cover modulators, and that was a huge deal, of course, and a huge fight for them to get insurances to cover these drugs. They also helped to get a bill through to our Utah legislature to help to ban copay accumulator programs. They helped to get our bill a sponsor and to help find support in the legislature. They helped to get advocacy groups to sign on, and they worked tirelessly researching to get the most update information to our bill sponsor. And while our bill did not get through the legislature, the the battle is not over, and the experience and the help that the pharmacists gave to us in this endeavor is unparalleled. They were huge help to help not bankrupt their families. So finally, what has our pharmacist given to us? I want you to just think for a moment about what you could do with an extra 1 to 4 hours every month. What hobby could you spend time on? You could watch an extra movie, or two. You could exercise more. There's so much things that you could do with an extra 4 hours a month. In the era of COVID, I can complete school assignments running 4 curriculums without having constant interruptions to try and get my daughter's medications figured out. My kids need their mom now more than ever when we're all home together, and they want my attention all the time, and to not have to constantly be telling them, just a sec, mom's on the phone with insurance, just a sec, mom has to do this or call this pharmacy, or just a sec, mom has to figure out this copay thing, is huge. Another thing our pharmacist has given us is confidence in the medications that they're getting and in the dosage, the safety of that dosage rather, because my daughter's pharmacist knows her so well, and he's known her entire life. He knows her allergies, he knows her sensitivities, he knows everything about her medically, and to have one person dedicated to making sure that she receives the correct dosage and that she is getting exactly what she needs it's unmatched. That confidence that is given to us, I can't tell you how important that is as a family. And as a mom whose child is on a lot of medications, and I only know as much as I can Google, and to have somebody that has her best interest at heart all of the time, and who will ensure that the insurance will cover what she needs, it is the biggest relief and the biggest blessing we could have. And I just want to thank everybody for listening to this presentation, and I hope you are having a great NACFC. And thank you so much for listening to our story. And thank you to all the pharmacists for all that you do for your families.
Hi, thank you so much for having me here today. My name is Jenny Livingston. I am a 33-year-old woman living with cystic fibrosis. I am a patient at the University of Utah Adult CF Center. There are no relationships to disclose related to this presentation. I am a mother, I'm a partner, I'm a college graduate, I'm a CF advocate, I'm a lot of things, but what I am most today is just totally thrilled to be sharing here at NACFC. It's a little overwhelming to be presenting along top scientists and experts in their field. What I have to offer is not scientific, nor is it information dense. What I have to offer is the insight that comes with 3 decades of living with this disease. Really, I'm just here to tell a story. I believe that our stories can be incredibly powerful. I believe our stories are what define us and set us apart, but they are also what connect us as humans. There is so much to be learned from the stories of other people, so I am just incredibly honored to be sharing my story with you here today. Although, in order to provide the best understanding and to properly tell my story, I need to back up a bit and first tell you about my sister Shannon. Shannon was born to my parents in 1978. From the moment she was born, my mom knew that there was something a little bit wrong. Shannon was an especially fussy baby in that she was always hungry. If while feeding her, my parents accidentally scraped the bottom of the bowl with a spoon, Shannon would start screaming because she thought that meant her food was almost gone. My mom tells the story of how Shannon, at just 1 year old, could eat 9 full pancakes in a single setting. She would often out-eat my dad or other grown men. Extended family members would joke about how much Shannon could and would eat, so at family gatherings it became like a game. They would feed her more and more just to see how much she could pack into her tiny body. What my family did not know was that due to the level of malabsorption Shannon was experiencing, she was literally starving. When Shannon was born, she weighed 8.5 pounds, and when she was 1 year old, she didn't even weigh 15 pounds yet. She was given the diagnosis of failure to thrive, but that didn't really alleviate the concerns that my parents had about her health. Shannon's full diagnosis came when she was 13 months old. My mom had discussed the possibility of CF with Shannon's doctor. She had read all the brochures she had been given. She had taken note of Shannon's symptoms, and she wasn't shocked when Shannon's sweat test came back positive for cystic fibrosis. But the news didn't really sink in until later that day. The diagnosis, the prognosis, new medications and treatments, a whole new lifestyle, really. I'm sure it was a lot to process. I cannot imagine what my parents were going through in the days and weeks and months that followed. They had finally learned what was making Shannon sick, but it wasn't something that they could fix. It was life-threatening and incurable. The day of her diagnosis, my parents transformed from two people with concerns about their child's health to a family dedicated to doing all that they could to fight cystic fibrosis. Because CF doesn't just affect the person who has it. From the moment of diagnosis, CF is a whole family endeavor. At the time of Shannon's diagnosis, my mom was 6 months pregnant with their second child. Teresa was born in 1980 and also tested positive for CF at birth. For reasons that some people may not understand, my parents chose to continue growing their family. Tommy came next, and then Jason, no CF. And then me, the baby, also with CF. As I'm sure you can imagine, growing up in a household with 5 children was pretty chaotic. Growing up in a household with 5 children, 3 of whom had CF, was just insanity. But it's all that we knew. Manual CPT was the gold standard of care in those days, so my parents would take turns having us girls climb up into their lap in odd positions and pounding us. 3 girls, 2 to 3 times a day. That was a lot of CPT. Things like enzymes, Ensure, feeding tubes, home IVs, port dressing changes, they were just the norm in our household. But that doesn't mean that they were always easy to manage and coordinate. I can remember my mom spending hours on the phone with doctors' offices, pharmacies, and insurance companies. I learned early in life that the words prior authorization were as unwelcome as curse words. I didn't know what they meant, but I knew that they caused a lot of problems. Of the 3 girls, Shannon always faced more health challenges. In fact, she spent so much time in the hospital or needing extensive care within our home that all but one of my memories of Shannon are centered around CF. Like the time we were riding to clinic in an elevator and Shannon sneakily handed me a can of Ensure, which she hated but had to drink. I guzzled it, silently handed her the empty can back behind my mom's back, and we shared a smile. We shared this secret, unbeknownst to my mother. Another time, I can remember walking into Shannon's hospital room where she lay unresponsive in the bed. I was eating the Jell-O from her food tray, silently looking around the room and absorbing all that was happening, and I knew in my heart that this would be the last time that I saw my sister. Shannon died in 1993 at the age of 14 while awaiting a double lung transplant. At the tender age of 6, I understood the permanency of her death and the ugliness of this disease. Shortly after Shannon passed away, my parents divorced and we moved to Utah. My childhood was spent riding horses, enjoying life in a small country town, and spending time with my cousins who lived nearby. My childhood was, as far as I was concerned, pretty normal. Sure, I had to do treatments, occasionally go to the hospital for a couple weeks, take pills, but I was given all of the opportunities that other children were given, and I was treated the same as my brothers. It wasn't until I became an adult and the burden of care shifted largely from my parents' shoulders to my own that I understood how much time and effort the management of CF requires. I'd always been the one doing treatments, attending appointments, having the procedures done, and doing the work of CF, or so I thought. I had never experienced being behind the scenes, making the phone calls to doctors, to insurance companies, arranging and organizing the many aspects of CF care. I learned that the mental and emotional duties sometimes outweigh the physical challenges of CF. I gave birth to my daughter, Morgan, who is the absolute light and love of my life, when I was 22 years old. My entire life I had dreamed of being a mom, but I had also consistently been told that it might not be safe or even possible for me to have a child of my own. This only made me love and appreciate the experience of motherhood more. As wonderful as being a new mother was, it was also incredibly difficult, and my health really struggled. My medication list seemed to be ever growing, and the time and energy it took to take care of myself also seemed to be increasing. At this point in my life, admittedly, I had an extremely difficult time staying adherent to treatments and medications. For one, I had a young child who demanded much of my time. I was also working full-time on top of having a baby at home. But the biggest barrier to adherence was navigating the complex world of insurance companies and specialty pharmacies, getting access to medications, and making sure that all the cogs of my CF care were working together smoothly. I'd sometimes go for months without refilling my medications because, one, I was unable to afford copays, and I didn't know of the assistance programs that were available to me. And two, I really struggled to effectively communicate with multiple insurance companies and pharmacies to coordinate refills, shipments, deliveries, payment, and prior authorizations. I did finally learn why my mom hated those words so much. It just seemed that there was always a problem that I was either too exhausted or too uninformed to manage effectively, and my health suffered as a result. There were multiple times that I'd lie awake in a hospital bed, genuinely wondering whether I'd ever leave. Unfortunately, my experience is not rare. Things like rationing medications due to cost, going without meds for an extended period of time because continued access is tricky, or spending countless hours getting the runaround on the phone, these things are not entirely uncommon. I have a dear friend who, during this pandemic, tried to refill her Trikafta prescription, and she was told by the pharmacy that she was unable to do so. She called her CF clinic, who informed her that her 3-month Trikafta labs were due and she could not refill until they were done. By the time she was able to get her labs done in the middle of a global pandemic and get everything back on track for her prescription, she had gone a month without Trikafta. I have another friend who once spent a total of 26 hours on the phone over multiple phone calls on consecutive days in order to get a single medication filled. Earlier, I briefly talked about the mental and emotional burden of CF, and this is definitely one of them. It's honestly one of the more stressful parts of having CF for me. I spend roughly 2 hours a day doing respiratory treatments, and that's fine. I take over 20 pills a day, that's fine too, no biggie. 2 weeks in the hospital, while it is not my favorite thing, I know I'll manage. But if I am asked to argue with insurance companies or hammer out the details with pharmacies, I will cry and beg for mercy. This is something I absolutely despise. Fortunately, I don't have to do that anymore. In recent years, I have benefited in countless ways from my center having a dedicated CF pharmacist and pharmacy tech team. Each month I get a call from one of the pharmacy techs at my center. Together we go over what refills I need that month, determine what, if any, additional things are needed from me, and a medication shipment is scheduled. Sometimes as soon as the next day, all of my meds show up on my front doorstep. Recently, like my friend, my 3-month labs were needed for a Trikafta refill. But in my case, a pharmacy tech notified me of this a month before the labs were due, so I had plenty of time to get them done and never ran into issues getting my Trikafta. Whenever I have questions about medications or my care, a CF pharmacist with first-hand knowledge of CF is there to answer them and give me advice while empowering me to take charge of my own care. Because of the dedicated work of the pharmacy technicians at my center, I no longer struggle to navigate insurance companies, copay assistance programs, prior authorizations, or mountains of paperwork. They literally do all of that for me. I have never in my life had such consistent and easy access to my medications. When I tell family members or other friends with CF about my experiences, they are in complete awe. I've learned that not every center has a dedicated CF pharmacist, and even fewer have the pharmacy tech team that I benefit from so much, which frankly blows my mind. Although every member of the multidisciplinary care team is important, the value of having the special pharmacy team in every center is so clear to me. It's the CF pharmacy team who come up with the perfect cocktail of meds to treat my specific resistant bacteria when I'm inpatient. It's a CF pharmacist who ensures that the drugs I've been prescribed don't interact with each other, that I'm getting the correct dosages, and that my treatment plan is working for me. It was a pharmacist who monitored my INR weekly and made the correct adjustments when I did 7 months of Coumadin therapy. Coincidentally, that pharmacist in my tiny little hometown was a student of my CF pharmacist years ago. It was the pharmacy team who gave me information and training regarding an extensive MRSA eradication protocol. It was my pharmacist that texted to check on me nearly every single day when I was having terrible side effects from those medications during that eradication. And as I'm told, it was my pharmacist who went to bat for me in a staff meeting when my symptoms became unmanageable and we decided to stop that treatment. It is a pharmacy tech who every single month calls me to set up medication deliveries. It was an inpatient pharmacist who, before I even had the chance to ask about it, approached me to see if I was ready to switch modulator drugs and start my Trikafta journey. He then took the time to talk through my questions and concerns that come with changing modulators. It was a pharmacy tech who, when I had insurance changes at the beginning of the year, made sure that my prescriptions went to the right place, helped me track down meds when the new mail order pharmacy immediately lost them, and worked with the contracting department to bring all my prescriptions back to my preferred specialty pharmacy. Having these people as core members of my CF team means that they aren't just occasional visitors in my story, they're an important part of my journey. They are my partners in care. They know me, and they know my family, and they've been there through all the ups and downs in my life and my health, and they are always on top of my care. This partnership does more than just save me some frustration. It improves the quality of my care and my life tremendously. As I said earlier, CF is a whole family endeavor. My partner and my daughter both benefit from me having consistent access to medication and my care experience being a positive one. The day-to-day management of CF can be so incredibly taxing. So when someone is willing and able to lift even some of that burden off of my shoulders, I can breathe easier, both figuratively and literally. My mom can't believe how far things have come, both in the world of medicine and the ways in which we receive care. What a difference a pharmacy team like this would have made in her life when she was raising 3 young girls with CF. What a difference this would have made in my own life when I was struggling so much as a new mom who was just learning how difficult managing this disease can be. When the medical and scientific communities talk about reducing treatment burden for people with CF, I think it's incredibly important to remember that a lot of our challenges happen behind the scenes. If I'm required to spend hours unsuccessfully trying to navigate a system I do not understand, not only does my stress level increase, I lose valuable time. Time that could be spent on treatments, pursuing hobbies, making memories with my daughter, or attending to one of the other countless responsibilities related to my healthcare. These days, my life looks pretty similar to the joyous days of my childhood. I get to ride horses again, this time with the child I was told I may never have. I still live in that same small country town, and my daughter, just like I did when I was her age, spends her days playing and growing with her cousins. My CF is well managed, and I feel fully supported by my care team. They have helped me get through challenges that I truly thought I might not survive. They have helped me thrive. They have helped change my story. Combining the lived experiences of a CF patient, the expertise of a pharmacist, and the proficiency of a pharmacy technician makes for the perfect care partnership. This partnership has influenced and improved my life in ways that extend far beyond medication. It has truly revolutionized my care, and as a result, the entirety of my life. On a final note, since most stories have a way of coming full circle, I just want to quickly share that Trikafta was approved on October 21st, 2019, which would have been my sister Shannon's 41st birthday. Thank you so much for having me here today. Thank you for hearing my story, and a huge thank you to every single person who has helped make my CF story a happy one.